Arteries as they come out of the heart, so I'm going to draw the left or the heart here, and out of the heart comes the aorta, and the aorta will curve and arch around and then come down into the abdominal cavity and then split right around the belly button. So it's best to understand what comes off of this aortic arch in the thoracic cavity. Basically, there's three branches at the top. Okay? The most leftward branch becomes the subclavian artery. And then in the armpit area, it becomes the axillary artery, same artery. And then it goes down the left arm and is called the brachial artery. So again, subclavian, axillary, brachial, and then around or just past the elbow, the brachial will divide into the radial and the ulnar artery. In the middle branch off of the aortic arch goes up the left side of the neck and is called the left common carotid artery. It will branch and become the left internal carotid and the left external carotid. The internal carotid artery will supply much of the arterial blood supply to the brain. The external carotid artery will supply most of the blood to the left side of the neck and the head. Now this last branch, which is actually the first branch coming off the arch, is called the brachiocephalic artery. It's very short, brachiocephalic artery. It will then branch into the right common carotid, which will do the same thing that the left side did, into an internal and external carotid on the right side. It will then go on and become the subclavian artery on the right side. In the armpit area, it will become the axillary artery, and then in the arm, it will become the brachial artery, and again divide into the radial and the ulnar arteries. There's two other arteries that I want to talk about in the chest. Right past the carotids, as they come off, on the subclavians, there will be two arteries that come off and go to the back of the neck, and those are called the vertebral arteries. And they will travel up the transverse foramina of the cervical vertebrae and also supply blood to the brain, so vertebral arteries. There are other arteries that are coming off of the subclavian that I'm not naming. One final thing, the very first arteries that come off of the aorta are the coronary arteries going to the heart. So the first branches off of the aorta are actually the coronary arteries. Now let's move to the abdominal cavity. Here's the diaphragm separating the thoracic from the abdominal. I'm not going to name all the branches, but here are the very important ones for us. One of the very first branches that comes off is called the celiac trunk. It comes right off toward you and divides into three important arteries. One going to the spleen, called the splenic artery. One going to the stomach, called the gastric artery. And one going to the liver, called the hepatic artery. So again, the celiac trunk, very small artery coming off of the abdominal aorta, divides immediately into the splenic, gastric, and hepatic arteries. Just below that, there's a large, long artery coming off called the superior mesenteric artery, which is going to go to the small intestines. Just below that, there will be two large arteries going off sideways, going to the kidneys, called the renal arteries. And just below that a ways is another mesenteric artery coming off, going to the lower small intestines and to the large intestines, called the inferior mesenteric artery. The abdominal aorta continues. It divides into the common iliac arteries in the lower pelvic area, The common iliac arteries will divide into internal iliac arteries going to the reproductive organs and the bladder, and will continue as the external iliac arteries until they reach the growing area, the inguinal ligament, and then they'll pass down the leg, and they will change the name from external iliac into femoral arteries. The femoral arteries will divide at the level of the knee and become the anterior and posterior tibial arteries, with the posterior tibial artery being able to be palpated behind the medial malleolus. The anterior tibial artery will continue down the anterior side of the lower leg and continue on into the foot and become a pedal, P-E-D-A-L, pedal artery called the dorsalis pedis artery. And that's the pulse you can feel on the top of your foot.